Let it go. Beautiful. Beautiful. Wow. This is all lower here. Feel
my, yeah.
versus what in the world?
Oh, wow. Yeah.
My dad's favorite movie is that Young Frankenstein movie. You know what?
I love that.
Wasn't the hump on the other side?
What hump?
I'm exaggerating. This is what your alignment is.
Oh, wow.
You're saying the head's over to the right because you can't walk around with your head tilted. I'm exaggerating, but you see my point. You can't. This will make you dizzy. So your body does this to get the eyes level.
Well, for the past like 20 plus years, I've had almost perpetual knotting in my back, especially on this side.
Okay.
Lots of crunchiness when I move. It always feels like it's burning in my neck. Unfortunately, I have through my C4 through C7 a degenerative disc disease, and I just haven't been able to find a way to fix it. I've tried therapeutic pillows, which I'm using, and different neck aids to lay back on. Nothing seems to help.
So who told you about the C4 through C7? Was that through X-ray or MRI or?
It was through X-ray and MRI with a VA.
Okay. Did they give you an explanation for
No.
why? No. All right. Well, we're going to go through all that. The lower neck discs, the ones that C4 through C7, typically are the almost only discs in the neck that have injury. We don't really ever see injury to the C2 disc or the C3 disc, and they kind of put that it's age and weight or wear and tear as the cause. And I go, well, how old are the other discs? Why don't we hear about T3 disc injury? Why don't we hear about T8 disc injury? Why is it always mainly C5, 6, and 7 in the lower neck encompass about 99% of disc injury? And that has a lot to do with the alignment. So if the neck is curved, called a lordosis, is why you mentioned support of the neck a little bit, so you kind of have an idea, well, we're supposed to support something, and it's the arch. The arch is supposed to be in our neck to allow the weight of our neck to be evenly distributed over all the segments. When we have injuries or posture or life looking down, this curve goes straight, and then like a ladder, all the weight goes down to the lower neck. Now these discs are made of water. They're about 70-80% water, and as you inflame them or damage them, they start to cook like a piece of bacon. They get harder and crispier, and they term it degeneration, but I think that's a poor term for it. I think it's more like, do you call a piece of bacon when you cook it degenerated? It's like, well, no, you just cooked it, right? You've heated it up, and now it's changed from a soft, flexible structure to a hardened, crispy structure. Now when it hardens, it loses water and it thins out. So the purpose of these discs is to keep open that hole that the nerve passes through. And so as that disc becomes smaller, the nerve gets pinched. That's why they call it a disease process, but I don't call it a disease process. I call it an adaptive process because part of your spine has been doing too much work. So part of your spine hasn't been chewed on, essentially, and that part of your spine has been overexerted, overused. And so the alignment creates that. So there's a firing order to your spine. The upper neck is supposed to work first. The lower neck is supposed to work last. So it really shouldn't be possible to wear out where you're injured if the upper neck was working properly. That's one of the things we're going to check today.
Okay.
That's why we call it, you probably heard the word atlas axis a little bit, maybe?
A little bit.
So we named these top two vertebrae because they have a disproportionate amount of work and importance in the spine. If you don't have these two guys working, then the ability to injure your lower neck is very high. When the lower neck gets injured, the head goes forward. So I want you to see, like, for instance, I'm going to use this because it's a little bit bigger. When you bend forward, the hole gets larger when you bend forward.
Mm-hmm.
Same thing happens everywhere, but Carl, can you see that? The intervertebral foramen gets larger, so you might not have any pain shooting down your arm, and that's because the head went forward. You might, now it's hurting down my arm, right? That's part of the reason why your head went forward, to open up that hole slowly over a period of years. And so, no, Ed, I don't have any radiculitis. I just have this pain burning in my neck. Right, because you're in avoidance. Mm-hmm. The head went forward. Now, the consequence of the head going forward is now you have all this tension in your upper back. Mm-hmm. And now you have all these muscles that are tied up here because your head went forward to open up that foramen in your neck, and now you have what you termed crunchiness and tightness in the shoulders. The more forward the head goes, these muscles get tighter, and like guitar strings, they're easier to pluck. Then you move your shoulder blade around, and the shoulder blade kind of, like a pick, just strums all the strings in there. So
I know what you mean. That's what it feels like all the time.
Yeah. That's this, you're not, I mean, if you do that repetitively a long time, you ever have a turkey leg at Disney, those turkey leg tendons, you're not damaging, they're real tough. Well, you can have tendonitis if you repetitively, those tendons will get inflamed and bruised and hurt, but they're pretty tough, and so nobody really does surgery on that. It's more of an annoyance. But ultimately, we have to get your alignment upright, and then to do that, we have to make your spine supple. That's where you see me doing all the soft tissue work, making people's backs malleable, and then we have to mirror image stretch you. So if your body's here, we can't just ask you to be neutral. It's not enough. We have to actually go to the opposite extreme and then hold you there so that your body will want to be in the middle. It's an overcorrection. So it's like a tree. If it's bent forward, you can't just bend it to neutral. You got to take it the other way to make it want to be in the middle. We're just dealing with about an inch and a half forward. Your shoulder is, your head, your ear hole should be over the center of your shoulder. And the more forward the head goes, the muscles have to double their workload for every inch the head goes forward. So your muscles back here are under extra or double or triple the stress because of that alignment. Okay, 1 second. Okay. This shoulder's high. Your head's over to the left, so something happened over here and your body's trying to get away from it. And it doesn't hurt. Well, it's because you're in avoidance, or if it hurts even with avoidance, it tells you how long it's been there, that even though you've been tilting away from it. Hips, okay, hips aren't too bad.
For some reason, this hip, especially back here, started to hurt.
So the whole...
That's new.
Yeah, the master and commander is the head. Like, leave me your hand for a second and let you feel it. When I bend my head forward, see, it's supposed to be supple. Now watch, when I put my head forward,
it's tighter.
See how tight it got? All I did was just angle my head forward a little bit, because if that muscle doesn't contract, I fall over, right? Your body's supposed to be here. So the more forward your head goes, the more tense and stiff your middle back becomes. And that's part of the tension you're feeling. And then you'll start overworking the lower back. So ultimately the lower back is, having to listen to what the upper neck's telling it to do. And it's always about trying to balance the eyes and the upper neck.
Okay.
Let it all go. I got you. Let it go. There we go. There we go. Deep breath in. I got you. I know. Yeah, a little tight. I got you. It's okay. Exhale. There we go. Beautiful. Whoa. Oh, yeah. One more. There we go. Let it all out. A little tight there. We'll get it. There we go. Right, just like that. Turn your head just perfect right there. Take a deep breath in for me. Exhale. Yeah, I got you. There we go. That side for me. Beautiful. And breathe in. Exhale. Let's go face up for me. Beautiful. Let the chin go up for me, real gentle. We're just trying to move this top guy a little bit. I got you. Beautiful. There we go. Let it go. Beautiful. Beautiful. Wow. 102 years, chiropractors taught that adjustments change posture. I'm here to say that it's not true. I wish it were true. I really do. I really wish I could, push the curves back into your spine or some sort of shoulder adjustment to permanently get your shoulder back over your ears. That makes sense? It's not. There's ligaments, rubber bands that wrap your spine that need to be stretched. There's like fabric, and if you're not, adjusted and have your spine limbered up and cleaned up, you're not able to actually stretch very deeply, or you won't be able to do it very long because it hurts too much. And so everything I do on the table is prep work to make your spine limber, so that we can actually show you how to stretch. And then once you're able to stretch, your need for me or massage goes down. You should be able to be a little bit more autonomous, able to take care of yourself. And that's my hope to show you today, at least give you the groundwork to know what to look for and how to safely counter stretch. And at the end of the day, essentially, because your work involves either standing bent forward or just more, you're not looking up at the ceiling as often as you're looking down. We have to do things to account for that, and then all the years that you spent sitting at a desk or working, driving, all those things. There's an inundation of bending forward in America and very little training on how to balance our spine. Feel this knot up here. This is supposed to be your main engine.
Mm-hmm.
This is supposed to be the first vertebrae that shows up, the last vertebrae that leaves. And I got a lot of restriction here. That's what's allowed. So C5, 6, and 7 is all down here. Because you notice I'm not going to rub your lower neck because I can't help the part that's overworked by making it overwork more.
Mm-hmm.
It needs to be left alone, like a tooth that's cracked, needs to not be chewed on anymore. And we need to learn how to bend up here. The stretching that I'm going to show you at the end of the visit is what seals it and allows your spine to maintain that correct mobility so it doesn't just go back to old habits of continuing to chew on the lower neck again. But there is a little bit of, growing pains in the sense that because you're in avoidance, we're going to have the tendency to run into the very things that you're avoiding. And so I sometimes am in a lose-lose position here, right? If I bring your head back, we run into this. If I don't loosen this and bring your head back, we don't ever get rid of it.
All right.
So we're moving furniture around. We're opening up a closet and we're taking everything out and we're reorganizing it, but temporarily it's going to look more disorganized as we reorganize. It's really the only way to do it, though, right here. Has anybody ever showed you this knot? No? Nobody?
Oh, no, I feel it all the time.
Okay.
Sometimes it hurts all the way up into my ear.
Okay, well, body was trying to talk to you.
Oh, yeah, tell me something.
You're in what I call right abuse, left avoidance. It's a less common misalignment. Most people are in the opposite. Most people have a right atlas. You have a left atlas axis up here. But this side is definitely stuck. And your neck belongs way back here. Everything I do is about getting people's natural curves restored. If we had this natural cervical lordosis, the quote-unquote degeneration of your lower neck wouldn't have happened. There it is. I had a patient show my work to his chiropractor, and the chiropractor said to him, well, I didn't go to school to be a masseuse. And I was thinking, okay, well, if you adjust the vertebrae and it doesn't move, what do you do? Say to the patient, see you in a couple days. I use the massage as a way to get a deeper adjustment, to hasten the time it takes to get the spine moving, because ultimately adjustments don't change posture, massages, it's all just tools to make the spine limber so we can quickly get the patient to stretching, which is what's going to help you, and understanding how to brush your teeth. The tension's just postural. It's just the muscles aren't in here. The muscles in your upper back aren't tight to annoy you. They're not trying to ruin your day. They're going, we have to be contracted because of the position you're putting us in. You can comb the tissue and it stimulates a lot of blood to come to the tissue and rinse out all the acidity, kind of like plaque or crystals, sandpaper, grit that forms in here. Like right there, yeah. It's pretty quick, Carlin, on all that. What did you do to his neck? Gua sha. Our world mainly focuses on the effects and goes, well, how can we help the damaged areas? And it's like, well, they really can't be helped because they didn't do anything wrong. They just did everything. They're just responding to the overtaxing that you put on them. Real quick on both sides, this is just not a minimal amount of inflammation or congestion that's been built up in here.
I tried to have the VA take a look at it, and all they want to do is, they don't want to do anything. All they want to do is give you medication.
Right.
And I can't do that.
Well, they only can do what's in their tool cabinet.
Right.
They're not gonna. They don't chiro. Chiro means hand. I'm not trying to create anything new. We're trying to bring you back to where you used to be. You used to have a curve in your lower back. You used to have called lumbar lordosis, one down there, lumbar curve, lumbar support, cervical support. Um, the danger, remember how I showed you on that model that when you bend forward, the hole gets bigger, right?
Mhm.
So in the same way, bending forward makes it bigger, bending back makes it smaller. So it's going to be like, well, why are you bending me back? And that hole's going to get smaller and you're going to hurt me. Well, we got to make sure that they're all working evenly. But when you bend back, you actually take weight off the disc. So that very structure that they told you is degenerated, how do we stop the stress on that area? We have to bend back. But yes, that disc has no feeling, so we don't necessarily feel it while we're damaging it. And the joints on the backside have a lot of feeling. So that's why every elderly person's all hunched forward. It feels better to round forward. And so this is why a lot of doctors don't even want to go into the conversation of bending back, because you have to prep people. You have to explain what you're doing and then understand that we're going to run into things when we do it. We have to do it in a incremental approach. Can't just throw people into deep stretching, but your neck is limber enough, you're ready. The pec is, we would say, way stronger than the rhomboids. And so the pec's going to sort of dominate the upper torso, draw the shoulder forward, along with most everything in life is forward. So, Ed, I feel like I have to daily stretch my pecs, and the answer is correct. There is going to be
Wow.
yeah, we're going to need to stretch all this. Didn't realize this was so tender in here, huh?
No.
Yeah. This is the cause. The backside's just getting beat up because this is pulling it out of alignment. This all has to be lengthened in here. Like right here, that's all. Rotator cuff, labral tears will happen more easily because of the alignment. People are set up for those type of injuries. The more forward the shoulder gets, the more the rotator cuff muscles are held tight, the easier it is to tear them. The more forward the shoulder is, the more you ride the glenohumeral joint, the humerus on the lip of the glenoid fossa. So people are set up for those injuries based on the alignment, and they're not really told that, my alignment was the cause. But yeah, right here, AC joint, a lot of compression in here. Try to let that arm stretch. Just let that hang if you can. I didn't know that was all in there, Ed. Sorry, I know. I feel it. Yeah, right there. I feel it.
Oh, wow, that's crazy.
Sorry, 5 more seconds. Come on. All right.
Oh, I'm good.
Okay, all right.
I can take a lot.
Okay, all right. I'm learning. All right. Come on. There you go. All right. The tension, the tightness in the area causes a blood flow constriction, which prevents oxygen from getting in here to get rid of the lactic acid. It's really lactic acid that is causing that burning, that pain in there.
That's so weird. When you first were doing it, it was hurting like crazy, and then after a few seconds, it's like now it's gone.
Mm-hmm.
I know. Oh, wow.
Yeah, there's quite a bit right here in your pec. Wow. The head tilt, head translation causes shoulder tilt, torso translation. This is not, we don't say its own problem. This is a domino effect from the head. Getting the head over the shoulders and getting the head leveled will level the torso, but there's definitely going to be a significant amount of extra work happening in here because everything's trying to balance the wrong alignment. There we go. These are the roots here. These are all just the roots of your neck. The same muscles that attach up here attach into the shoulder blade, into the upper back here. picture, just for the viewers. So what we're seeing is that, see, the left side is all elevated. It's really this is what he's doing, an exaggerated form, then his head's over. But the left side being popped up, that's why his bone's sticking out over here. That's why he's pinching right lower. That helps.
Yeah.
But it's really a head tilt. It's this left upper neck here that's the ultimate cause. Usually these are more formative years. This feels kind of old in here. What was?
I was in Sea Scouts
Okay.
for 3 years, and we did a lot of, pulling, tugging, not pulling, or not tying, marching, and then 4 years of the military.
Gotcha.
But no real sports except for running. I ran a lot.
Uh-huh.
I was stationed with the Marines, so we had not only their pack, but my medical pack, which was like 25 pounds.
Mm. It does need a significant amount of time over here to make this supple. So it's gonna feel like, Ed, I feel like you rubbed the left side of my back a lot longer than the right side. The answer is correct, because this side needs to be leveled out first, and then we take the drawer evenly closed. The drawer's kind of crooked.
Right.
We gotta level the drawer first, and then we take it straight. But yeah, all this. Mhm. And then also when the head goes forward, the ribs rise up. They call it like a bucket handle in school. So when the handle's down, it's not very noticeable, but as the rib rises up, the handle comes kind of straight, vertical. That makes sense? And then when you move your shoulder blade around, now there's other things in the way. The rib heads, the muscles are held tight. And so getting these ribs down can only be accomplished by getting the head back. So again, it's another reason for the crunchiness in your upper back. Yeah, right there. Oh, man. Feel that? That's what you're running over. But this is the ribs that are raised. This is just, that rib shouldn't be bucket handle so elevated. It's the same sound we heard earlier. This is angled upwards because of the head forward. We call it coupled motion in chiropractic biophysics. The head goes forward, this has to elevate. It's just a cause effect. There we go. There we go. I mean, they're elevated on this side, but it's about half. Not sure if you notice. Because of the tilt. So it's not only is your head forward, but it's forward and it's tilted. So it's elevated the left side a lot higher, and then you're pinching this. This side is getting abused. But the amount of rib misalignment is less on this side. Just this in and of itself will symptomatically make you feel better. This is what, to me, the Chinese figured out, that you can just comb the tissue and symptomatically feel better. If we don't change the posture, we get into this discouraging place where it felt great for a couple days and then it comes back. You know, if we can get the posture changed, you're not gonna, you know, it's like, was it teach a man to fish? Right, one of those things. Like, if I give you a fish, you're just gonna be hungry. If I teach you to fish, you'll be fine. You know, I'm gonna try to teach you to fish, not just give you a piece of fish.
I'll apologize in advance for the skin tag on the other
Yeah,
side.
you're fine. You're fine. I've seen everything. It's just, this is the first pass with a carpet cleaner. I'm running a vacuum cleaner, and this is like the first pass, and you always get the most out the first, time it's run, and then every subsequent time it's less and less, and don't be
Until there's none.
until there's nothing. Right. The question is then how many passes do you have to make, and the answer is I have no idea. You just keep making passes until it comes up clear. There is no.
Until you get to the center of the Tootsie Pop.
How many licks till the center? Isn't the one, the commercial's like, 1 or something?
That's exactly what I thought.
I miss those advertisements.
Yeah, 1, 2. I don't know how many passes. Mm. ATP is the energy currency in your body, and when your body breaks down ATP, essentially lactic acid is the waste product. Oxygen is supposed to bind to it to form carbon dioxide and water. When there's not enough oxygen in the area, because either you're building up too much acidity faster than it can be bound, or there's congestion, tightness, preventing blood flow from getting in, that acidity gets trapped. That's what you ultimately feel as pain. When you touch an area and you go, ah, that's the acidity. It's an acid, it irritates nerves and it's not pleasant. So this is what the gua sha attempts to address, which is that acidity. And then in and of itself, it's like if we just address the acidity, but we don't take, it's like if we just clean the floors, but you keep walking in with your shoes on, you're just going to keep tracking in mud. We want to address the problem, which is, take your shoes off the front door.
Gotcha.
But yeah, this spot down here is just the poor lackey down here left doing all the work. I'd almost, if you were here so local in Sarasota, I'd almost spend the first 5 visits exclusively working on this, just to level it. To get, it's like a 1/4 inch, 1/2 inch higher on the left, and so it needs to be leveled. And then like a drawer, if you keep pushing the drawer in evenly, it'll stay crooked as it's going in. We want to level it first, and then it's going to be much easier to change. And then, whatever was buried in here, whatever the cause, to me, this is just an effect. But there can be injury in here also. To me, it's ultimately the upper neck, but there can be, percentages of both. There's some percentage of, no, Ed, I got somebody collided with me here, or ran into me, or whatever. I fell, something collided, and then because I hit this, I leaned away from it, and now I go to the right because I'm in left avoidance. It can be. I'm just, again, without, who knows. It definitely feels like there's some injuries in here. And
That's the thing, I don't remember ever falling on anything hard.
okay.
I've done indoor surfing, but it's a cushion that you fall on.
Sure.
So it's not really hard,
I got you.
no accident, but no, I definitely feel what you're talking about.
Okay, all right. I know, I'm going on top of it. Are you?
Wow.
It's your back that's unlevel.
Right.
I feel a
right.
huge difference. This is all lower here. Feel
Oh my,
that
yeah.
versus what in the world?
Oh wow, yeah.
I mean, it's huge. There's not. It's all low on this right side. There's the right, and then what?
Oh my.
Right. It's okay. My dad's favorite movie is that Young Frankenstein movie. You know what?
I love that.
Wasn't the hump on the other side?
What hump?
So yeah, we got enough. This has probably been your saving grace, is that your SI joints are moving. So this when you were on your side, these joints didn't. They weren't frozen.
Yeah, I'm always on my feet, except for on breaks. We drive standing up.
Right.
Yeah.
So maybe, like some say, that's keeping these joints moving, and that's giving your lower back.
And I tend to speed walk.
You can see that. Wow. Yeah, that's the. That's all that injury. It's all injury. That's where those ribs are all raised. That's where it's all popped up right here. Because this is popped up, I was trying to show when you were face down. I was trying to, show is that do you see how when this left side is elevated, it makes your head travel to the right.
Right, I mean, even when I was laying down, I see my left shoulder's higher.
I'm exaggerating now. This is what your alignment is.
Oh,
You're
wow.
saying the head's over to the right, because you can't walk around with your head tilted. I'm exaggerating. But you see my point, you can't, this will make you dizzy. So your body does this
Uh-huh.
to get the eyes level. That's because you have an injury on the left side of your neck that's caused a head tilt, and then
Oh, wow.
that's really just a domino. There we go. There we go. Relax your leg. I got you. Good. Very good. There shouldn't be these giant gaps. You understand? Like that was a normal ankle movement. You understand? It was like a little click. You understand? It didn't have this giant chasm that I was from where the bone was and where it needs to be. Yeah, normal.
Oh, wow.
Normal ankle adjustment. Then press back with your elbow a little bit into my elbow. Here, a little bit. Yeah, moved.
Oh, I'm sorry. I didn't know.
You did good. You did good.
Oh,
You
okay.
moved. Yeah, you got it. And just like that, look up for me a little bit, and then press back. Here we go. Good. Yeah. Oh. Check your ear. Is that okay?
Oh, sure.
Cool ear
Yeah.
fun. So check your ear out a little bit. Got you tilt left for me. Tilt left. So I get almost there. Okay, I'm just checking. Tilt your head left. Okay. Just seeing if there's anything in the air. Go ahead and tilt your head to the right. There we go. A little bit. Tilt to the right. There we go. All right. There you go. Perfect. Yeah, this is the good size for you. And that's where you need to hang out. Now, with your neck, you have give you like a 1 month prescription where you are allowed to turn your head just ever so slightly left, just a little bit. Remember, because that knot is a little bit bigger on the left, so we want to get a little bit more pressure on that left side. Sometimes you'll take your hand and you'll press it into your forehead to get your head to sink in. Does that make sense?
Mm-hmm.
And then you put your hand back down, see if your head will stay there. Sometimes the second week that you do this, it's more difficult because your neck's actually starting to do it properly. And it's getting harder because your neck's starting to actually conform to the mold and actually do it the way it's supposed to be done. Sometimes it's not so difficult at the beginning because of the rigidity and the non-compliance and the unwillingness of your neck to actually sink into the device. The goal is 20-minute sessions is your first checkpoint. The back of the neck might go a little warm or tingly. That's okay. If you start feeling something going down your arms or your fingers start going tingly or numb, go ahead and stop.
Mm-hmm.
If the lower neck starts to hurt, it shouldn't. But if the lower neck or upper back starts to hurt or pinch, go ahead and stop. But if it just hurts where it's pressing, you shouldn't. I don't think you're going to run into any of the things. But the back of the neck will go warm and tingly because the pressure on the skin, is significant because your neck doesn't want to actually curve and comply. That will go away as your neck gets more normalized to being curved. We need blocks behind your head. Does that make sense? To support this so we don't overbend the lower neck.
Okay.
Right? We were trying to make this bend here without annoying the lower neck.
Right.
And watch me do it. See how my neck is...
Oh, wow.
My neck is not doing the bending. Right?
Yeah.
So your back wanted to do this. See, my back is stiff and my neck is bending too much.
Mm-hmm.
All right, yeah, go give it a shot. See, I know, it's a little different, huh?
Yeah.
Yeah.
It actually feels more open here, which
Yep.
is weird.
Rest of your life, end of the day, open up that chest. And just, like I said, it's going to be a little bit of a journey. Don't go crazy pushing yourself too quickly because I generally would want to monitor you because we're going to run into things. And so your first goal is time. Beautiful. Very good. Thank
so
you.
much.
All right, appreciate it. Thank you.